everyone, I'm Yang Wang.
And I'm Nikki Uchea, and today we're going to be looking at the TIC Hospital Price Compare tool. Okay, let's start by looking at this introduction. It says here that the commercial prices for hospital care are expensive, varying, yet opaque. This tool uses commercial prices disclosed by 5 national insurers for 10 common hospital services. For each service, this tool shows the lowest enrollment weighted average and the highest commercial prices across 38 states and 50 of the largest metro areas in the US. Okay, I guess my first question is, who is the target audience for this tool?
Great question. For context, there is a federal regulation called Transparency in Coverage, or TIC, that requires commercial insurance companies to publicly disclose their negotiated prices. However, these negotiated prices are enormous, complex, and very technical. Therefore, this tool aims to democratize the disclosed prices to the broader audience, especially to the employer-sponsored health plans, which are the dominant buyer of commercial health services in the US. And in particular, the employers can use this tool to be informed about the price ranges for common hospital services in their local market and support their cost-saving strategies.
Okay, neat. So if I'm an employer, how is this tool showing me the lowest price points in my state or metro city?
If you put the mouse in the states that you are interested, this tool shows you how much first the Medicare program pays for hospital services as a baseline. Then it shows you how much the lowest, average, and highest commercial market prices as a percentage of the Medicare baseline price. Among the commercial lowest category on the right, this bar shows you which states would have the lowest prices.
Oh, okay, that makes sense. So if I'm an employer in New Jersey and I need to cover the cost of an employee's knee replacement surgery, this tool tells me that the lowest commercial price it could possibly be is 130% of the Medicare payment we're using as a baseline. In other words, the lowest commercial price is 1.3 times greater than the Medicare payment.
Yep, and if you are in Colorado, for example, looking for the lowest price of the same service, you will see that it is 292% of Medicare payment, which is nearly 3 times greater than the Medicare baseline price.
Wow, that's a lot. I guess that's why New Jersey is blue while Colorado is in orange. That makes sense. How does this savings number come into play?
Assuming the employer is currently paying the average commercial price for service, this percentage, the savings percentage, shows you how much the employer could save if they pay the lowest commercial price instead.
Oh, so the percent of savings is comparing these two numbers.
Exactly. Other public visualization tool typically shows you the average commercial prices relative to the Medicare payment. But the unique strength of this model is that it shows you the full range of the commercial price. So the users would have a better idea regarding what is a fair or competitive price in their local market and how much they could save for each hospital service if they pay the lowest prices.
I see. And I'm sure policymakers would find this helpful because it shows them what the highest commercial prices are, so they could kind of make the case for lowering high commercial prices.
Yep, and in fact, these state and local government themselves are employers offering health coverage to their government employees. They are exploring different options to contain their healthcare spending, and this tool can definitely be helpful.
Okay, could we go through one more example?
Sure.
Okay, let's say as an employer in the Chicago metro area, I need to cover the cost of a C-section. Oh, this is already very blue, so that's a great starting off point. It looks like the lowest commercial price point is 1.44 times greater than the Medicare payment, and the average is 1.6 times greater than the Medicare payment, which means I could potentially save 14% on the cost of that service if I negotiate and pay the lowest price with the insurance company. Would I be negotiating that price before or after the patient gives birth?
As an employer, you would be negotiating this price before you renew your plan for the next year. So whenever you talk to your benefit consultants or insurance companies before the plan renewal, this is the time you can use this tool, especially the lowest market price, as a very powerful number to help you negotiate lower prices for your plan.
Okay, gotcha. Okay, one more thing. Something I noticed the other day when I was playing with the tool was that when I select two services at once, everything gets much more orange. Is that because it's showing us the price of covering two services at the same time?
Yes, but this tool is designed to show prices for only one service at a time, so make sure you don't choose multiple services at once.
Okay, I see. Wow, this is a pretty neat tool. Thanks for going through this with me.
Yeah, of course. Thanks for stopping by.